It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So my friends, what's going on with urology in Lehigh Valley Hospital? Well, we have good news for you today. We're going to interview Dr. Courtney Phillips, who is a urologist, and I'm excited to have her on the show. I'm sure she brings a lot to the greater Hazleton area and also the Pottsville area. So Dr. Phillips, thanks for coming on the Sam Lesante Show.
Thank you for having me.
It's a pleasure. I'm excited to talk to you about urology because I used to go to Dr. Chevron Austin every year for my checkup, etc. So tell me about you.
About me, so I just moved here in November. I've been in New York City for the last 19 years, where I did my residency and my fellowship, and I was in practice there for 10 years. And decided to make a change and came out here in November. So I grew up in New Jersey, though. I'm a Jersey girl.
Are you?
Yeah, I got rid of the perm, but.
What part of Jersey were you?
The Shore.
Oh yeah.
Yeah.
The Shore. So tell me, why? First of all, what made you decide to become a doctor?
Well, I was really sick as a kid, so I was abandoned in Korea and I was adopted, but I was very, very sick as a child. And I was in and out of hospitals all the time, and I was always amazed that when I went to hospitals, how much better they can make you feel, even if you weren't getting better. And I thought that was a really interesting and profound thing, and I was super interested in helping other people do that.
All right, so you went into general medicine?
Well, so I did medical school, and then I decided to specialize in urology. So we do 2 years of general surgery, and then I did another 4 years of urology residency, and then I did 2 years of fellowship, subspecializing in cancer and kidney stones. Okay,
let's go back to, you were born in Korea?
I was.
Okay, and were you adopted when you were in Korea?
Yes.
Okay. So coming here to the United States, how old were you when?
I was 9 months.
Oh,
yeah.
Then you don't remember. Okay.
I don't remember a thing,
okay.
but I grew up thinking I was Italian.
Well, you are Italian. If you were raised by Italians, you're Italian, okay? Take it from an Italian. So when you were in, it often fascinates me because, when I talk to people who have professions, some will tell you, well, I really wanted to be a race car driver, and they end up being, a CEO of a major corporation. You wonder what happens, okay? So because you saw all the health benefits, you had that desire. So was always a desire to become a doctor?
Always. Wonder Woman wasn't on the table, so I figured being a doctor was the next best thing.
Why not Wonder Woman?
I tried. I had the underoos. It didn't work out for me.
It didn't work out for you.
No.
So why then go into urology?
Well, it was really interesting. I think when you're a medical student, people tell you you're either going to do medicine or you're going to do surgery. And that's sort of a very easy break. I was really interested in working with my hands and doing surgery or something with procedures. But I also liked the longevity of knowing patients over the course of years, months, etc., instead of just operating on someone and never seeing them again. And I think urology offers the best of both worlds in that sense.
Now, when you started, how many years have you been practicing?
I've been practicing it's now going on 11 years. 11 years.
Mm-hmm. So I know how innovative our business is, okay, with the cameras and editing machines, and you buy something today that's fantastic, and in 6 months to a year later you find something that is different, okay? So the reason I'm asking this question, there's been so much knowledge learned, I guess, in different facets of medicine, right? Mm-hmm. In urology, in the last 11 years, have you seen new advances in different tests? Or, because you hear different kind of, about like PSAs, you hear different things and when you should go and all this other kind of stuff.
Sure. I think our advancement has been on multiple fronts. So if we were going to talk about, for instance, just the pure operative machinery that we have. When I started in residency, no one was really doing robotics, but people were starting to do laparoscopy, and now we're doing robotics. And LVHN just purchased the first single port robot in the Lehigh Valley, which is, going to revolutionize, I think, robotic surgery. So that didn't exist 11 years ago. We also have seen over the last like 10 years the approval of more prostate cancer related drugs than we've seen the prior 30 years, which is pretty remarkable. So I still think we need to do some work on biomarkers for cancer, especially with, you know, bladder cancer biomarkers and prostate cancer biomarkers, but we've made huge strides. And that's why it's also difficult sometimes for somebody to step away from their career and come back, because you come back to a field that's so different.
Yeah. Exactly. So it always fascinates me because, again, you know, with the advances in medicine now, for male, of course, you know, prostate is a concern. So what are some of the talking in the male area here, being that I'm a male, and I mean, I know when I start going for, you know, my blood tests, etc. When is about the time that you should start getting your PSA number?
Well, I think it's not when you should get your PSA number, it's when you should start discussing it, because it's not the appropriate test for everyone, and it's not a mandatory test. It's not like a colonoscopy where you should do a colonoscopy when you hit a certain age. I think at the age in your 40s, you should start addressing it with your doctor or your urologist, saying, is this the right test for me, knowing the pros and cons of this test? And I think that that's the most important thing. We've heard a lot of controversy about whether or not PSA is a useful test, and I think in a lot of contexts it is, but I think, again, we try to treat everyone individually, so what might be right for you may not be right for somebody else, and that's the conversation I want to have with people.
Okay, so what would be, sometimes you don't have any symptoms, I mean, or do you have symptoms?
Most of the time you don't have symptoms, and that's one thing that I really need to impress upon people, because a lot of people look at me and they're like, but I feel fine. And unfortunately, most cancers, you feel fine at first. If everyone felt really sick the second they got cancer, we'd find all these cancers very early, and we don't. So a lot of times patients will have concomitant symptoms of prostate enlargement that aren't necessarily related to cancer, you know, but that will drive them to urologic care, which brings them in the door, which is important. But at the same point, a lot of patients are asymptomatic.
So does the blood count, I mean, mean something when you go and get a PSA? I mean, I get blood work and they do the whole profile.
Right.
And then it has your PSA number there. I mean, is that important?
I think it has to be taken within a context of what was your prior blood count, what is your family history, what are your other risk factors, your age, your comorbidities, how big is your prostate. The larger your prostate is, the higher your normal prostate blood test is. The older you are, the higher the index is for your normal prostate blood test. So again, it has to be taken as a whole picture.
So what's the rule of thumb? You get an exam once a year, every 2 years, or what's your rule of thumb?
I think we've really loosened up on that, but for somebody who has a normal PSA and their exam's normal, they are asymptomatic, once every 2 years is fine. But once we start to see a patient around the age of 75 or 80, or who has multiple comorbidities and they don't have a 10-year survival, we stop checking, because most people, if I diagnose them with prostate cancer now, they'll be alive in 10 years from that disease.
Why is that?
Because it's a very slow-growing cancer in most cases, not all, but in most cases. And so if we look at the autopsy data from men who are over the age of 50 who die of any cause, okay, heart attack, stroke, what have you, approximately 1 out of 3 of those men will have prostate cancer. And if we look at 80-year-old men, 80% of 80-year-olds will have prostate cancer. Now we know that 80% of 80-year-olds and a third of 50-year-olds are not dying of prostate cancer. So a lot of this disease never causes more mortality in these populations. And again, that's the difficulty, is finding out who has a prostate cancer, but also who has a prostate cancer that's actually going to impact their life.
Now, on the women's side, okay, what are some of the areas there that women should be concerned about?
So I think we deal with a lot of women. In fact, 40 to 50% of my patients are female. We do cancer in women, which includes kidney cancer, bladder cancer. We also do female incontinence, pelvic prolapse, and kidney stones. And so we do see a lot of women.
And here again, is this from routine checkups that certain things pop up?
I think that some of these things are from routine checkups, especially when you talk about kidney cancer and bladder cancer. Kidney stones usually declare themselves in a very dramatic fashion.
Yeah.
And incontinence is one of those things. You know, people don't like to talk about it, but it affects so many women, and they need to know that there are options. You don't have to walk around and feel like ashamed of the issue. It's very common, and you know, it's something that we can help you address.
All right. So what do you like best?
What do I like best?
Yeah.
I like getting to know the patients. I like helping them meet their health goals, and not just in urology, but in their lives. So much of what we do is impacted by our health, what we want to do with our families, what our goals are at work. If you're not healthy, you're not going to reach those. My goal is to keep you off of my operating room table. My goal is to keep you out of my office. And to the extent that I can do that and help you, that's what I want to do.
And so here's the question. The question is, how then does one know, okay, that they need to come to you? Okay, they go to their family doctor first, or how does that work?
I mean, a lot of times people do go to their family doctor, and the primary care physicians in this community and in the Pottsville community have been amazing as far as knowing when to send people. And we, because of our electronic medical record system, every time I see a patient, my note automatically goes to their primary care doctor so that we can have an open dialogue about what we're doing for that patient. But yes, a lot of patients do come directly from the primary care doctor, some come from the emergency room, and some self-refer. They kind of know. They're like, I have this history, I saw a urologist in another state, I need to find one here.
So what all you had going for you, or have going for you, why did you decide to come to the Lehigh Valley Health Network?
You know, I was super impressed by the commitment that this network has to amazing care. They have, I think if you look at the global healthcare market, all healthcare organizations and networks are expanding. They're all buying each other and expanding and merging, but it's with what care and what thought that a network does that I think is really important, and it speaks to the values of that network. And I've been very impressed that when Lehigh Valley does something, they go in and they want to make things better. They want to look at the specific needs of the community regardless of whether or not it makes money. And they want to address those needs, and they want to do it with quality. They're not willing to just plug in anyone just because they have a warm body. You know, it's like putting a warm body on the field in a football game. Sometimes it's better to have nobody.
That's interesting because, you know, for years, okay, I've been talking about the great healthcare we have here. And there's certain areas that you have to leave the town from, I mean, but in terms of what the Lehigh Valley Health Network did, is just raise the bar continuously in the area. And I'm glad to hear you say that. Folks, I'm talking to Dr. Courtney Phillips, urologist. You can get her at 570-501-7020. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, SSPTV.com. Download the app. Just search SSP TV. Download the app. All of our programs here, especially all the health shows that we have, particularly this one here that I'm doing with Dr. Courtney Phillips, who is a urologist, joining the Lehigh Valley Physicians Group. It's interesting because she comes with some great experience. So we're talking about experience and, you know, why you went into be a urologist. You like it?
I love it. I'm very fortunate.
Yeah. You do a lot of studying?
I do. I think that that's really important. I think one of the most important things as a doctor is that we offer patients the most state-of-the-art care, while keeping the personal touch, obviously. But things are changing so much. We just talked about that. I think that if you fall behind the times in a year, 2 years, then we're not doing the greatest good. And that's what we're here for, is to do the greatest good for the most number of people possible.
We talked about what's your favorite part of your job?
I mean, I really like getting to know the patients and helping them be healthy, not just in a urologic sense, but in a whole sense.
Okay, so share with me a patient, you don't have to mention the name, but a patient who may have come in with a particular problem and what you did and how the results were. Because I always like to have testimonials, you know, especially when you're talking to a person and say, look, I had this symptom, etc. I went to see Dr. Phillips, and, you know, could you share any experiences with me that, without mentioning any names?
So I saw a patient, this was actually in New York City before I left, and he was actually my very last patient before I left New York City. And I had seen him a couple years earlier, and one of my assistants was starting with him, and she walked in and put 2 cards down on my desk, and I was like, what is this? And they were 2 driver's licenses, and I was like, is that a fake ID? I don't understand. She's like, you have to come in here. And I walked in there, and it was a patient I had seen earlier. He'd been about 150 pounds heavier. Ooh. He had had a urologic issue. And part of it was related to his weight, but we also talked about how his weight was really keeping him from doing certain things in his life and how it's having an impact for his urologic conditions. And we just discussed things he could do, ways you can change, because how you work that into your lifestyle is very different for everyone. And apparently he took it to heart. He went home, he went on a diet, he started exercising, he ended up getting a lap gastric band after he lost the appropriate amount of weight and lost 150 pounds, and it changed his life. And he heard I was leaving and he came in, he's like, I needed to catch you before you left to let you know you changed my life.
So the weight had an effect on the urological condition?
Absolutely.
So
we know
obesity
that,
may have how does that work?
So we know that, fat doesn't just sit there. Fat is actually metabolically active, and it causes diseases, and it has such a global impact on your health, but it can cause urinary frequency, it can cause incontinence, it increases your risk of dying of prostate cancer, it increases your risk for malignancies, it increases the risk that if you have a malignancy, you are not going to do well. I mean, there's so many things that obesity does. If we don't address that, we are not addressing the actual problem that people are coming in to see us for.
That's very interesting.
Yeah.
Yeah, I mean, I had some doctors on that talked about obesity and they have procedures, etc.
Sure.
But you're breaking it down as the fact that it can, obesity can really cause you a problem, your urology,
Of
your
course.
urological condition.
And we see so many adults that have this, but then what kind of example are we setting for our children? How can we show them how to live active, healthy lives for the next generations to come? And I think that that's a really important thing that we have to take the time and talk to our patients about.
Well, I think that's interesting. Now, where are you? You're in 2 locations, right?
So I work in Allentown, I work in Pottsville, and I work here in Hazleton as well.
How often are you here in the greater Hazleton area?
So I'm here on Monday mornings and Thursdays all day. I'm in Pottsville Monday afternoons and Fridays all day, and I'm in Allentown Tuesdays and Wednesdays.
So, did you hire a chauffeur yet?
No, but for a girl that didn't have a car for 19 years, I'm driving an awful lot.
That's now in Pottsville, folks, we're on channel 190, so you'll be able to catch the show there. You work with some people now, right? You Harley Williams.
Yes.
Who is?
She's our physician's assistant in Hazleton, so on the days that I'm not here, she's in the office. She's fantastic. She provides quality care. She provides a lot of consistency. She really gets to know the patients and can deal with emergencies, walk-ins, etc. So she's really given us a lot of access as far as people getting in the door and getting care.
Courtney, we hear about PAs, and a lot of people, in fact, Tammy, we have had a number of PAs on the show, and they tell you what their experiences are, etc. So, sometimes I want to see the doctor. Okay? And, well, I'm a PA. So how does one, differentiate from the PA that you have, this Harley Williams, will I feel comfortable going to see her?
I mean, I personally think you'd feel very comfortable with her. She's got an amazing bedside manner. She's very gentle. She's calming. But apart from that, she knows what she's doing. At the end of the day, there's not much that differentiates her and me except for some training. And my job is to make sure that she knows everything, that she can take what I do and what I say and what I think and give that to the patient as well when I'm not there. So that's part of my job. But apart from that, I don't see that there's a lot of difference.
Do they train specifically for urology?
So they can kind of subspecialize in school and they can pick things that they're interested in. But then a lot of the training comes, once you choose a job. And so we had her in 6 months of intensive training and, not quite seeing patients, but shadowing people, learning, reading, and we're very intent. What I like about the Lehigh Valley Health Network is they really want everyone to work what we call top of license. They want you to do and learn as much as possible and to do as much as your license will allow you to do. And if you want to go for more education, they want that for you. We take no pride in you not learning and not being better. And so I think that that's really amazing.
So 11 years of experience, okay? And from what like me, every year I learn something, okay, even though I'm 40 years old. That's a lie, Tammy, I just want to know. I'm 41. No, anyway.
I'm older than you.
Yeah, so you don't look it, you look like you're a kid. So when every year you learn something, all right, and it brings to the table. So, and that's the interesting thing about, the network. You have different affiliations like Sloan Kettering, okay? Not that every case you have, you go to check. But I mean, the point is there's a lot of opportunities available in those areas. Am I correct in saying that?
Yes, and what that also allows us to do is bring clinical trials out of New York City to this area for drugs in different combinations that aren't available outside of the trial setting. And I think that's really important. We're doing some very interesting work with that.
I think that's really interesting, because the more you learn, and you're continually studying, okay? I always ask people, particularly if they're in a profession, I don't even have to ask you this. You have a passion for what you do. You have to have the passion for it and the love for it, because that's so, and that comes across, I think, when a patient comes in, okay? I always say bedside manners, I think, are always important, because the doctor is so important to that person. And you have to be just as fresh for the first patient as you are to the last patient, You can't be drawn out for the day and say, I'm tired. Listen, you're the last patient, and I really have time to talk to you. I mean, that doesn't happen.
Yeah, a lot of times I leave my most difficult patients to the last slot of the day, because that way, if I have to tell you have cancer or you want to come in and talk about a surgery, I can spend as much time as I need with you. I don't need to get back home. I can spend an hour, 2 hours, whatever it takes.
So I don't want to be extremely optimistic here, because I know there's various cases, but when you have cancer, it's not necessarily a dense death sentence. Am I correct?
No, and again, cancers are like people. They're all totally different. So how one cancer behaves may not be like how another cancer behaves. We always say of prostate cancer, it's a cancer that you might die with and not of. But there are other cancers like bladder cancer. There's two types, where the one that you die with and the one that you die of. And then, different cancers like testicular cancer, you do have to treat it. And so, again, there's that kind of wide dichotomy of how these behave. And again, that's why it's so important to respect the biology and the physiology and the natural progression of these diseases.
Okay. So once again, we're going to take a break, we'll come back. But once again, you're located in Pottsville, Allentown, and Hazleton.
Yep.
Okay. Folks, the number here in this market area is 570-501-7020. So if you need any help or want any information, give them a call. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. We're learning a lot about the urology department here in Greater Hazleton, Lehigh Valley Physician Group. I'm talking to Dr. Courtney Phillips. Really a great person, and if you've missed any part of the show, we played a number of times. It's on our app. Just search SSP TV or go to our website or go to the Lehigh Valley Hospital, the website, and learn about Courtney Phillips. Now, Courtney, just so we get an understanding, we said you're in Allentown, Pottsville, and Hazleton.
Yes.
Now, you do surgeries in Hazleton, right?
Yes, I'm doing smaller procedures here, but because I'm not here every day and I can't round, I'm only doing things where you go home the same day.
Okay, so for people in the greater Pottsville area,
yes.
Okay, the phone number, which is 570-501-7020, is the same number they call, right?
Yes,
okay.
for Pottsville.
Now, all right, so we mentioned that if I call that number and I say, look, I have a concern, okay, whomever could respond to that, do they have to go to, before they come to see you, do they have to go to the family physician first to get recommended?
That's really dictated by your insurance. If you require a primary care referral, then unfortunately you will have to contact your family physician, but a lot of insurances don't require that, and you can self-refer.
Okay, well that's good, because and I think even if you have a referral, if a person has a concern, I don't see any family doctor or saying, no, don't go and get checked, okay?
Exactly.
Right. So once again, your main area is urology,
yes.
Okay, and you've been practicing for 11 years?
Yes.
All right. A little bit about yourself. You were adopted?
I was.
By a wonderful Italian family.
Mm-hmm.
Are they still living?
Both my parents are still living.
Is
yes.
that right?
Mm-hmm.
Are they living in Jersey?
No, they moved. My dad decided he didn't like the snow or the taxes and moved down to Florida, and my mom decided she wanted to be closer to the beach. She's down in the border of North and South Carolina.
Oh, okay. Well, that's good. And you have any siblings?
I do. The week my mom found out I was coming in the mail, she found out she was pregnant. So I have a little sister.
Isn't that something?
Mm-hmm.
That always happens, doesn't it?
That's what I hear.
Right. So your urology experience just grows each year and each year, each year. Once again, you don't have a rule of thumb of when a person should come to get checked out, if male or female. It's just routine checkup sometimes that will give us some little red flags?
Well, yes, and we'll never fault you for coming in just to ask questions. Okay. That's what we're here for. We don't have to operate on you. We don't have to. We are here to provide information to help you make the right decision for yourself, because again, what might be right for you may not be right for somebody else.
That's good. Well, it was certainly a pleasure meeting you today.
So nice
and
to
you've
meet
been
you
here
too.
since December, right?
November, yeah.
November, yeah. And I wish you the best. But the location in Hazleton is where?
It's on North Sherman Court.
Where Dr. Shevardnadze's office
Exactly.
was. Okay. And in Pottsville, where is your location?
It's on East Laurel Boulevard. It's near the Pizza Hut.
Okay, yeah, I know exactly where it's at because
Okay.
we're on Channel 190 there. It's at, yeah. It's a nice area. Pottsville's a nice area.
I love Pottsville. It's
I've been
great.
there for with our program for 13 years, and they're really great people. You know, really great. I wish you the best, Courtney, Dr. Phillips. I really wish. Come back again.
Awesome. Thank you so much for having me.
It was my pleasure. It really was. Folks, Dr. Courtney Phillips, Lehigh Valley Physicians Group, Urology, 570-501-7020. If you have any questions, give her a call. I'm sure you'll be very happy. We'll see you next time.